Welcome to today's session with my humble introduction. Let's go on to see the different categories of the questions. It can be divided into the easy, medium, and the hard. The expectation is the easy question should be answered correctly by all the doctors. This is the expectation. In the opposite part, the hard questions, it will be hard, and it is not expected that all categories of doctor, all calibered doctors may not give the correct answer there. So medium category is expectation is medium expectation. So we will try to show you today what could be the example of easy, medium, and hard questions. The inner truth will be that in the exam, the number distribution, score distribution will be different. For example, hard question may be offered with 5, 6 score. The 5 marks for each question. And the medium in between and the easy may be only 1 marks. So it will not be mentioned in the question paper, but by gazing, we can understand that it could be a hard question more or less. So it actually doesn't bother our performance and others, means that we need to prepare ourselves for the exam without considering which one is a question, which one medium and hard. It is just for understanding. We actually divide it into 3 parts or 3 categories. And the content of the question, please follow me. It could be the diagnostic challenge. That means question contain diagnostic challenge, the management challenge. Both the diagnostic and the management challenge together will be there in the same question. And some direct question like, what is your name? What is your father's name? Like that. And some other question will be only information type. That is, which is the best information, or which is, I will show you, rather better not explain right now. And from there are some other question also we can add as the topic related with the histology, genetics, and the prognosis. We are talking here mainly based on the pattern of MRCP questions. I believe that this categorization or classification, though it is arbitrarily done by ourselves, is almost true for all the exams in the world. So the last one, the question set from the topic histology gene and the prognosis of some diseases. Prognosis usually questioning are done in the advanced stage of the examination. Suppose MRCP part 1 and part 2 written, the prognostic question will be more in the part 2. So similarly, in any other exam, the advanced part will contain more and more prognostic questions. But in the MRCP part 1 also, little simple prognostic question could be there. So similarly, any other exam like AKT in the MRCGP exam or other PLAB exam as a licensing exam, there is a part 1. That means the initial part exam, they contain as such. So by gazing, you can see now, suppose a question will ask the diagnostic challenge, that what is the diagnosis? If you compare the first with the third, both diagnostic and management challenge. So relatively, you will understand that it will be a little harder question, the third one, than the first category. So the third one will contain more marks. This is very expected. Anyway, let's see now our traditional question first and then go to the SBA or best of 5 question sample. First of all, this is actually our traditional question, especially in our South Asian pattern. Still, though we are fighting to improve it, still it is remaining. For example, contraindication of methyl dopa. That is what is the contraindication of methyl dopa? So this is a type of information and they design in a question. Answer is active hepatitis. The options are there 5 or 6, 7, whatever we know. But the information of these contraindication of methyl dopa, how it is designed in MRCP, we can see somewhere else. Okay. Before that, don't think that this question is related with the methyl dopa or other. It is in one type of question. For example, we are showing as easy question. May I request Dr. Nadreen, please? It will be helpful for me as well. Can you read it? It will give you some pleasure also, Dr. Nadreen. The scenario quickly. Dr. Nadreen, if you remain suddenly busy, may I request Dr. Zareen, please? Can you read just if you can see?
Yeah.
Dr. Nadreen, ready?
Yes, yes, doctor,
Okay.
I hear you. I hear you.
Fine,
Yes.
fine. Please, just quickly.
Yes. But I cannot see the screen.
Sorry?
63-year-old male
Yeah,
admitted
yes,
with 30 minutes history of central chest pain and sweating. His ECG shows elevated ST elevation, reveals ST elevation, and
yes,
leads 2, 3, and AVF. Which of the following coronary arteries is the most likely occluded?
yes. So this is the question basically from anatomy, right? Coronary
Mm,
anatomy. Coronary
yes.
anatomy. Uh,
Yeah, 2, 3, and AVF. This is the
yes. So what coronary artery is most likely to be occluded? Which one?
anterior.
There are two coronary artery, left and right, right?
Yeah.
So now I like to add something here also. Suppose in your question bundle, you will
Mm.
find there are 5 options are there, A, B, C, D, E. Is that it?
Yes.
So let's discuss now the technique of reading the question bundle here.
Okay.
So when you read the question bundles, uh, first of all, you don't look at the options. You create your own answer first. If question is as such, okay?
Yes.
But there are some different questions. If I say information type questions,
Mm.
so we cannot give any answer also, it is true, without looking at the options A, B, C, D, E. But here, we can give
Mm.
one answer by ourselves. So first try to give an answer. What could be the answer here?
Left
Everyone
coronary
can
artery.
participate. Yes, doctor, which coronary artery? So what will be your answer?
Left.
Left coronary artery. That
Right
means
coronary.
the anatomy is related with the 2-3 ABF. So we need to know about the ECG also, right?
Yes.
ECG
Mm.
also. So in lead 2-3 ABF, is ST elevation is there. This is myocardial infarction. Is that it? So
Yes.
this knowledge of ECG is linked here, as well as the clinical symptomatology also linked here. Okay.
Yes. Yeah.
Now the question from the anatomy, left or right. So your answer is left coronary artery. Who can else give the answer different?
Yes. Yes.
Sir, right coronary artery.
Right coronary. And Dr. Zarin, what do you think?
Sir, right coronary artery.
Right coronary artery. Let us see. Now, what we actually in our courses also we develop this is as what will be the key words here. This is probably the key words in the question. It is called the stem of the question, stem. And this question sentence is called the lead in. It is a part of the question. And these are the options, A, B, C, D,
Mm.
E, like that. Now you correlate that what are the options here. As you said, right, left, all of you, maybe some of you are right, but there are some other branches also named as such, obtuse marginal, posterolateral, circumflex. Could it be the best answer, anyone from here? It may be also possible. So even then,
Circumflex artery.
uh, left anterior descending or other. So right coronary artery is mentioned here directly, left coronary not mentioned. So
Mm.
more likely left coronary will not be the answer.
Mm.
Could be other branches or the directly the right coronary artery. So some colleagues say this is right coronary artery. So it could be right. It could be right. But Dr. Nadrin, can you revise your answer from here?
Yeah. So,
Now look at the picture. When we give the answer, if possible, we have to memorize our pictures in the book or the text or learning materials. So 2-3 AVF actually indicate the involvement of the inferior surface of the heart. here down.
Yeah.
So you can see now the 2,3 ABF, that means the inferior surface is supplied by which artery?
Right?
Right coronary
Right
artery.
coronary artery, yes.
So what will the answer now?
Right coronary artery.
Right coronary artery. I like to add now to other colleagues as well. What is our traditional question from here? Suppose from this picture box, Dr. Imran can say, the question possibly like in our traditional one is, which artery supplies inferior surface of the heart? Right, Dr. Imran or Dr. Zareen as well? This is our traditional question.
Yeah.
Which artery supplies inferior surface of the heart? So this is a question of anatomy. But in nowadays, the latest structuring of the questioning is like that. It include the clinical information, it include the investigation, and then anatomy all together. But the message is same, indirectly almost same. The knowledge is almost same. So this is the difference of the traditional question and the advanced, that means the latest technique of exam available in the world. This is one. Second, another one. Dr. Nadrin, please, you can continue, please.
Okay. So, 29-year-old
Female,
female
yes.
who is 22-week pregnant is noted to have blood pressure is of 150/90.
Yeah.
And on 3 separate occasions, urine protein is negative. Which of the following would be the first line treatment?
This is also similar structure as before. We need to give the answer by ourselves first. So may I ask Dr. Zareen, please, what will be the first line treatment? Blindly, you can gaze and give one answer. 22 weeks pregnant lady. Dr. Zareen, can you open the mic, please?
Yes, sir.
What you are thinking? Many antihypertensives, you know. In the pregnant lady, what will be the answer?
The hypertensive drug should be given her.
Okay, which drug? You see, which would be the first line treatment? You need to mention one antihypertensive medication, name of that. There are many drugs, right? Calcium channel blocker, beta blocker, other. Which will be? You can do mistake, don't worry. You just tell one.
Right, sir.
You are confused to say, Dr. Nadrin, please.
Methyl dopa.
Methyl dopa. So now this is the way. Think first by yourself without looking at the options. Okay. Our keyword is 22 weeks pregnancy here. That is in the pregnancy state, which drug will be the better? So there are options, you see. Is the methyl dopa here or not? So Dr. Nadrin thinking methyl dopa. Okay, one option is methyl dopa, alpha methyl dopa. But there are some other options also.
So nifedipine.
So now you are thinking nifedipine.
Yes,
so my suggestion as a technique to Dr. Zareen, think one step back. Okay. Understand? That is the traditional question bundle you are getting now. Right, that options are there. But during learning, think one step back. Means from here. Don't look at options. Think first one drug by yourself. Because when you actually correctly think the answer, you will get in the option and it will be the best answer, more likely most of the time. Understand? So now this is the real picture shown in the question bank. So ethanol, magnesium and other also. Now, suppose Dr. Nadrin selected alpha methyl dopa. Now the time to revise all the options. Is there any better option than my option? That means, is there any better option than methyl dopa? Dr. Nadrin, you can check. If There is nothing like that. And your answer is the alpha methyl dope. Option A will be the correct answer according to your answer. Dr. Nadrin, what do you think?
Yeah, methyl dopa is there, but now I am confused between methyl dopa and
You become confused.
magnesium sulfate.
Yeah, magnesium sulfate. Now we have to depend upon the knowledge of use of mag sulf or magnesium sulfate in hypertension in the pregnancy. Dr. Zarin, having any idea? Magnesium sulfate? Have you seen anywhere the medicine used? It's usually used in the obstetric wards, the labor ward, rather to say, or before the labor.
Yeah, and
In
eclampsia.
the eclampsia. So is the patient now presented with eclampsia?
No, no.
Why no?
22 week,
Okay.
no proteins.
No protein. Yes, no protein is one good. Another thing, if eclampsia, there will be the convulsion also. There are some other
Yeah.
symptoms as well. So it is not pre-eclampsia also, right?
Yeah. Mm.
So if it is not the eclampsia, so magnesium sulfate will not be the best option, more likely. Okay.
Okay.
So now,
So methyl
we are confident to give the answer alpha methyl
methyl
dopa.
dopa. Yes.
Dr. Zarin, possibly you understood.
Yes, sir.
Fantastic. So now, if we categorize the question, in my sense, I told you this is arbitrary. It could be easy question, but they are asking about a management challenge, right?
Mm.
The previous one also just easy question, but not the management challenge. Direct diagnostic question. Now this is the question from the management part. Okay. There are some other messages also in the question. Look at the blood pressure 150/90 on 3 separate occasions. What is the reasons of saying such thing? Who can say that 150/90 on 3 separate occasions? Why? Dr. Nadrin.
What again, doctor? What's the question?
150/90 blood pressure. So as a record, as a figure, this is high blood pressure, but they mention it is found in 3 separate occasions.
Yeah.
Why 3 separate occasion words are mentioned here in the question?
To confirm that the blood pressure is genuinely high. I mean, like
Yes,
31
yes,
times.
yes. This is the method
Yeah.
of confirming high blood pressure. So we are learning some other thing also from the question, not only a management or just to know to say the name of a medication, not only there. There are some other things also, especially diagnosis of hypertension also discussed in the question. So this is the glamour of such question, really. Fantastic glamour. Now, Dr. Zarin, please, I'm requesting you just to go through the question and then we will discuss later, no problem. Please carry on.
A 30 years old woman who is 24 weeks pregnant, present with a blood pressure on 3 separated occasions of approximately 160/100, and her liver function test show aspirated transaminase.
Aspartate transaminase, that is the
Sorry.
ALT, right? Aspartate
Yes, sir.
transaminase.
150 and alkaline phosphatase 213.
Aspartate, sorry, AST. Aspartate is AST.
AST.
Aspartate transaminase is 150, that is high. And then?
Yes. Alkaline phosphatase 213.
This is also high.
High. And bilirubin is 31. It's also high.
This is also high. So liver function is abnormal.
Yes. Which antihypertensive is indicated?
So this is the first step of reading the question bundle. Clear now, Dr. Zarin?
Yes, sir.
Definitely the options will be given and you will see in your learning bundle, question bundle also with the options. But first look, don't look at the options. Dr. Nadrin, I think you understood. Right?
Yes, doctor. Sorry, I have patient.
Oh, sorry, no, you'll be busy, no problem.
Yeah.
Okay,
Just give me
okay.
10 minutes, doctor. 10 minutes. I will be with you.
Okay, no worry. So, Dr. Zarin, which antihypertensive indicated? So, you are thinking that 24-week pregnant lady, okay?
Yes, sir. Yes,
And
sir.
the blood pressure, again, 3 separate occasion. That means you are confident about the high blood pressure, 160/110. liver function abnormal. But we know that in the pregnancy, the drug of choice is methyl dopa. We answered before.
Yes, sir.
Right now, could it be again methyl dopa or could be their alternative drugs? So these are the keywords, decision-making informations.
Yes, sir.
Abnormal liver function test. If I know that alpha methyl dopa is not useful or beneficial in the abnormal liver function test, or it is contraindicated, so alpha methyl dopa will not be the answer here. So we have to choose the medication from other group. Okay.
Yes, sir.
Now look at the options, including methyl dopa as well.
So labetalol.
It means that you know that the labetalol also can be given in the pregnancy.
Yes, sir.
From there, you can choose labetalol, but why not ramipril? Why not irbesartan? Can anyone say? Okay, it depends upon your knowledge. We are not here to discuss the details of antihypertensive medication in pregnancy. This is not the agenda today also, just to ask. Our agenda is only technical part of the questions. So these are not indicated, they're rather contraindicated, ramipril, that means ACE inhibitor, ARB. Now the remaining is atenolol and the labetalol. From there, better option, which one? It depends upon your knowledge. This is the labetalol.
Yes, sir.
That means first choice could be the methyl dopa, but as liver function is abnormal, so our option will be the next one is the labetalol. But we have seen before, the methyl dopa is the first choice in the pregnancy. Right, Dr. Zarif?
Yes, sir.
Okay, so the liver function is here abnormal. That we discussed initially, contraindication of the methyl dopa. Can you remember before? The traditional question we have shown in the first question, contraindication of methyl dopa was the abnormal liver function test, active hepatitis. Can you remember?
Yes, sir.
Okay, so better not to go back if you can remember. Now, another traditional question, causes of secondary hypertension. So this is our knowledge box. Causes of secondary hypertension, alcoholism, obesity, pregnancy, renal disease, endocrine disease, and drugs. So this is a box. So our traditional question, cause of secondary hypertension, suppose if I tell you one box, you can answer from there. And people are learning box, right, Dr. Zarin?
Yes, sir.
Dr. Imran also knows about the which box? Davidson's medicine box. So the box is box, but actually this is a very backdated tradition of learning. Anyway, now the next question, Dr. Zarin, please.
A 23 years old female present at 16 weeks into her first pregnancy with a blood pressure of 144/96. A 24-hour urinary collection reveals a protein excretion of
0.7 gram
yes,
per day.
0.7 gram per
Per
day.
day.
What is the most likely explanation of this finding?
Yes. So here, if you can come to a conclusion to explain by yourself, it is good. But what explanation they want to know, it may not be clear to us. For that, in this type of questions, we can see the options, right? A, B, C, D,
Yes, sir.
E, we can see. But even then, can we try without looking at the options? What actually message given to us? 23-year-old female, young lady, 16 weeks, that was just after first trimester. And it is her first pregnancy, primary, right? Blood
Yes, sir.
pressure just high, 144/96. But her protein in the urine is 0.7. Protein is high.
Hi, yes.
If it is high, why protein is high? What could be the informations here, correct information? They may ask many informations.
Mm.
Suppose if we synthesize here, the option could be one will be written as it is primary hypertension, it is secondary hypertension, it is glomerulonephritis, right? Could be like so and so,
Yeah.
okay? Or it could be patient going to develop eclampsia, patient is suffering from preeclampsia. Maybe many options are there. I am not sure what option could be there. In the previous question, we guessed that the option will be different name of the medications. Can you remember? Alpha-methyl-dopa, atenolol, ramipril, other. But here, what explanation the question, the person created the question is asking not sure. In such situation, technical point of view, better to look at the options first. This is the options. That means without wastage of time, because when the options are not clear to us, look at the options and then select your best one. Considering the keywords here, 16 weeks, protein excretion, like so.
Yeah.
And this is your knowledge box. Utilize the box. Don't think that this is the answer. This is only my highlighting yellow. It is not related.
Yeah.
Okay.
But
It is
after
unrelated.
you cannot say this is eclampsia, right? Or preeclampsia.
Why we cannot say eclampsia?
I think eclampsia after 20 weeks.
So this is the information. It is not 20 weeks or more. It is 16 weeks.
Yeah.
So it is not eclampsia or preeclampsia. Okay. Then
So normal changes of pregnancy, no.
no. Okay.
Gestational
Everybody can try.
Gestational hypertension.
Gestational also in the 16 weeks or after 20 weeks?
Mm,
Gestational also defined is a little differently according to the weeks of the gestation. Not any weak patient having high blood pressure is gestational hypertension. So now you are stuck in your thought process. Think that it could be a difficult question or hard question. Now clear?
yes, sir.
Easily you cannot come to a conclusion. So it will be actually a hard question. Now, thing is the primary and secondary. Primary hypertension means the essential hypertension. If it is pregnancy induced or gestational hypertension, then it could be secondary hypertension. Okay. And if it is essential hypertension, usually essential hypertension happen in later age. Now things are complicated. Okay. But why protein is high? Is it a complication of the hypertension? Hypertensive nephropathy? Or it is a cause of the hypertension? Cause means glomerulonephritis. What we are thinking? If you consider the renal cause, you see, glomerulonephritis, parenchyma renal disease, particularly glomerulonephritis. So proteinuria is a features of glomerulonephritis. If can correlate this protein loss is glomerulonephritis, can we select that it will be secondary hypertension due to renal cause? As we cannot fit from A, B, C, D. Yes. So now you can understand to give a correct answer here, how many things we have to consider. Understand? That means we have to consider here what is primary hypertension or essential hypertension, secondary hypertension, gestational hypertension, preeclampsia, normal physiology of the pregnancy, all together. And in the secondary cause, that causes of the proteinuria, that means the glomerulonephritis. So this is the summary answer. So could it be very easy question, Dr. Zareen? What
It's
do you
hard.
think? It's a hard question. So hard question deserve more marking. Okay, more marking. Again, one question for investigations of hypertension. So this is the information box. Investigation. We are doing investigation for all patients. You see urine analysis, protein and glucose. This is mandatory. Urea, electrolyte and creatinine. Okay, and the electrolyte give many messages. Anyway, this is the box. An additional investigations box down. Now come to a question. Standard. Dr. Nadrin, are you free now to read?
Yes, doctor. Yes.
Easily legible for you?
Yes.
Please, please, please. Otherwise, we can help. No worry.
Okay. طيب 38-year-old patient with recent onset fatigue and prior hypertension present to the endocrinology clinic as his potassium remains low on oral supplements. He has no medical history. Of note, a full endocrine profile is requested at the clinic. Through the most recent available blood tests demonstrate ongoing hypokalemia. Full blood count, normal serum sodium was 138, and serum potassium 2.6, urea 6.4, and creatinine 70. What imaging would you carry out?
So this question is selected from the investigations of hypertension. So
Yeah.
after thinking all together, you can create your own answer. What imaging will you do? Chest X-ray, MRI, CT scan, and which area? What you are thinking, Dr. Nadri? So the problem of electrolyte disturbance here, right?
Yeah, electrolyte disturbance.
Previously hypertensive patient, now having potassium low, right?
Yeah, potassium low.
Remains low on oral supplementation. Oral supplementation means we are giving oral potassium, even then potassium low. That is a persistent low potassium.
Yeah.
Doesn't have any other disease apparently. Endocrine tested done. Most recent available demonstrate ongoing hypokalemia. Okay. Full blood count normal, serum sodium 138, potassium 2.6. Urea is normal, creatinine 70.
Yeah.
So all are normal, only potassium is low. So a patient hypertensive with low potassium. What was the question? Question is they are asking mainly first you formulate a diagnosis, probable diagnosis.
Yeah, this is a
Then decide the imaging. So hypokalemic hypertension.
It's yeah.
So where is the disease? Where is the disease now? Dr. Zareen, can you try also? And Dr. Imran as well, if you can. Hypokalemic hypertension.
Sir,
Cons disease?
Cons means endocrine. That means the adrenal disease.
Yes. Ultrasound.
Sir, cons Cushing due to the hypokalemia.
Cons and Cushing. What is the clinical feature? Is there any clinical feature of Cushing?
Sir, cons, most likely cons.
Why not Cushing? Cushing almost always will be symptomatic with some features, but
yes, sir.
He has no medical history of note.
Cushing?
Patient has only hypertension without any other feature, right?
Yes, sir.
He has no medical history of note. So it is unlikely to be Cushing. Though Cushing also will have hypokalemia. You are right. Dr. Zareen, can you follow?
Yes, sir.
So formulate one such answer that if it is adrenal, whatever now, if you're confused that it could be Cushing or it could be other. Now Cushing syndrome, another is Cushing disease, you are confused. But if you think if it is adrenal disease, okay, it could be adrenal Cushing also, right? I'm not telling the Cushing disease, rather Cushing syndrome, adrenal Cushing syndrome. There are some adrenal disease also can cause Cushing syndrome. But commonly Cushing disease means pituitary disease. Anyway, so if it is Cushing, though unlikely to be, disease in the adrenal gland, as well as if it is a Cons syndrome, disease in the adrenal gland again. Dr. Zarin, clear?
Yes, sir.
So now which imaging? Anyway, so first of all, we will image the adrenal gland. Now,
Yes.
which image is better for the adrenal gland? It is X-ray, it is MRI, it is CT scan. Possibly they will ask in this manner. Now you come down at your option. Up, okay. Okay, I'm showing the box, your information box. So that could be Cushing or Cons, pheochromocytoma as well. Could it be pheochromocytoma? Unlikely. Usually pheochromocytoma have some other features also. Second, pheochromocytoma usually does not have any electrolyte disturbance. Remember. Okay. So these are the investigation list. So which investigation important? Imaging, ultrasound, angiography, X-ray in different areas responsible. Even for the adrenal gland, we can do for MRI, CT scan. Many things are there. Imaging, they mention only 2-3 imaging are here. Anyway, now let us see what they are telling to us. So all of these are the keywords already we mentioned. And sodium, you see, just normal. It is not low. Usually not low in the electrolyte issues. And these are the options. What imaging? Now select if you think that this is adrenal. So which image, Dr. Zari?
X-ray, okay. CT abdomen.
CT abdomen. Okay. So if it is a cons or where cons written somewhere, hyperaldosteronism, right?
Yeah.
Hyperaldosteronism is the cons. So this is the CT abdomen will be the answer here. Okay. This is the Cons syndrome. Low potassium. But Cons usually does not have high sodium because sodium excretion is happen. It is called escape phenomena. It is a different
high
physiology.
sodium and low potassium, doctor?
Usually it is expected theoretically, but in practical situations, kidney usually excrete more sodium in this disease. Okay. The excretion of the sodium happen more than usual. So sodium will not be in the high level too much. It will remain in the normal limit. Okay. Though potassium is low. Understand?
So low
It is
potassium, low
called,
sodium?
yes. The explanation here is the action of the aldosterone is to retain sodium and excrete potassium, right? But
So it
here,
comes.
but here, the one time it is said aldosterone escape mechanism by sodium. It happens in the kidney. That means kidney excrete more sodium by itself. That means that it ignore the effect of aldosterone. Sodium ignore the effect of aldosterone. It is called aldosterone escape mechanism. So what is in neat outcome? Neat outcome in the Cons syndrome is low potassium but normal sodium. So this is a diagnostic challenge to us, first of all. If I don't have a correct diagnosis, so I will not have a correct imaging, correct investigation. That means This is a diagnostic as well as a management challenge. Investigation also part of the management. So this is a which type of question, Dr. Zarin? Simple, medium, hard? What do you think?
That's medium.
Huh? Medium?
Medium.
Dr. Imran? Is it medium or hard?
Medium.
Medium, because you came to know the answer here for that. After explanation.
Yes, sir.
Dr. Nadrin, it is
Yes.
easy for you?
It's medium.
Medium.
It depends upon how much I
But
prepare.
my opinion, humbly to say, it is a hard question because if
Mm.
you don't know the escape mechanism, you are confused about the diagnosis because sodium is
Yes.
138.
Yes.
So did you know the escape mechanism before?
No.
No. Dr. Zarin,
No.
Dr. Imran, possibly you didn't know. Escape mechanism, aldosterone escape mechanism. If you don't know escape mechanism, you cannot formulate a diagnosis also here. In that respect, it could be a hard question. Okay. Now, both diagnostic and a management challenge question here. Dr. Nadrin, can you read it?
Okay. 45-year-old woman is referred to the respiratory clinic with the shortness of breath. She has been unable to work due to long-term back injury, and therefore on long-term sickness benefit.
Benefit.
Yeah. On examination, her blood pressure 155.
Sorry, open the mic again, doctor. Yeah.
Yeah. Her pulse is 85 regular.
Can you repeat? You couldn't hear your voice. On examination, her blood pressure is 150/85.
155/85. Pulse
85, pulse 85 and regular.
Yeah, and her BMI is 32. There is
Yeah.
bilateral lower limb pitting edema with the varicose vein formation. Heart sounds are normal. Auscultation of the chest is clear. Investigation show a pH of 7.43 and PCO2 is 5.8 kilopascal and PO2 is 9.9. Which of the
Kilopascal.
following is less?
Okay. It is 10 up to 13.3. One dash is not mentioned, right? Range given 10 up to 13.3.
Yeah. So she's low. Which of the following is likely to be the most effective therapy? So her pH 7.43, PCO2
Upper normal,
5.8.
right? Okay.
Yeah.
It is a normal. Oxygen is just low.
Mm.
What is actually diagnosis?
What is the most effective therapy?
So those who are working in emergency room, you may face such problem. Patient having the shortness of breath, oxygen is just low, but lungs clear. Dr. Zarin, is there bronchial asthma? What do you think? Dr. Zarin?
Yes, sir.
Bronchial asthma?
No, sir.
No. Why no? Auscultation of the lungs or the chest clear is
No, sir.
unlikely to be bronchial asthma. Is it in a valvular heart disease?
No, sir.
No, sir.
No. There is heart sounds normal and there is no added sound as well. So what could be other cause of the breathlessness here in this situation?
Sir, pulmonary embolism.
Why you are thinking?
Sir, features suggesting here is a long-term back injury.
Back injury and he is in rest.
Rest.
Sickness benefit, he is in rest. Immobility.
And BMI is 32, DVT.
There is a chance of DVT, bilateral lower limb pitting edema with varicose veins. So there is a chance of DVT. So background is there. So in this background, clinically we are thinking it could be pulmonary embolism first. But in the investigation profile, in the asthma, for example, what will be the partial pressure of oxygen? High, normal, or low? in general, initially in the asthma, partial pressure of oxygen will be normal. When there will be the severe asthma and silent chest, can you remember the word silent chest? Chest
Yeah.
movement will not be there. In that case, oxygen will be low. But otherwise, until patient ventilate, rapid breathing, it maintain the oxygen level. So oxygen also seems to be normal in the asthma initially. But in the pulmonary embolism, oxygen level will be low. So background of the pulmonary embolism and the breathlessness is here. So what you are thinking? It is a pulmonary embolism. Which of the following likely to be most effective therapy in this situation?
Low dose of heparin.
Now the therapy will be in two setting. One is the emergency setting, another is the after emergency.
Emergency setting.
If it is in emergency setting, yes, in emergency, you are working in the emergency room or you are working in the ICU or SCU, HDU, whatever. What will be the effective therapy? Dr. Zerin said what?
The low molecular weight of heparin.
Low molecular weight heparin. Okay, Dr. Nadurin?
This is a frank case of PE.
Okay, so treatment?
Oxygen.
Therapy means you are thinking oxygen. Okay, oxygen will be good. Other options?
Heparin as well.
Heparin as well. Could it be warfarin also?
Faster, yeah.
But warfarin could be given for the long-term management.
Yeah.
Now, the scenario asking us, it is emergency or routine patient.
Yes.
What do you think?
So it's in the emergency setup now. So we need the oxygen and
No, I am asking the flavor of the question. Flavor of the question. Is it emergency breathlessness or is a routine patient or you are working? What you are thinking there? Refer to the respiratory clinic. Can you see here?
There's emergency.
No, it is not emergency. It is respiratory clinic. Emergency is
clinic,
emergency. It is called
Sorry.
ER, right?
Yes, sir.
ER. Dr. Nadrin, what do you say?
yes, emergency.
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 Emergency room. In some
Yes.
country level, different way.
ER, yeah.
It is not mentioned. The patient is referred to ER. Okay, somebody say accident and emergency, AE, whatever we say. But patient sent to the respiratory clinic means it is not emergency. Understand?
Yeah, the respiratory clinic means it's like a
It is not emergency. Usually clinic
yes.
doesn't mean emergency. Emergency is emergency. It's a separate department.
Yes.
Understand, Dr. Zarin?
Yes, sir.
This is the message of the question, right?
Okay.
The question contain many informations, not only the question. Like what is your name? Eh? So now look at the options here. Before that, look at the keywords: partial pressure of oxygen, chest clear, varicose vein, oscillation. And the patient having what Dr. Imran said that the sickness benefit patient is actually having the back injury and is immobile. So altogether pulmonary embolism and most effective therapy from there. So what you said, warfarin is, sorry, heparin is not there. Why? Because it is not emergency management right now needed by anticoagulation. It is already done before. Now,
Yes, sir.
chronic medication. So if it is pulmonary embolism, then you can select warfarin, isn't it? But if I don't have this information stored, what we do? We do oxygen and we give the salbutamol and other inhalers. But it is not asthma. It is pulmonary embolism. So here we have to formulate first diagnosis and then management. So it is both a diagnostic and management challenge. Dr. Zarin, is it Easy question,
No, sir.
medium question, or hard question? What do you think?
It's hard.
Seems to be hard. Dr. Nadrin?
Yes.
Hard.
Hard, but it could be
Hard.
medium. No, for him, for Dr. Imran, it is medium because he got the clue here. Back injury,
So it is
long-term
hard.
sickness benefit. So it could be medium for him, Dr. Imran. But investigation could be hard. What I said, the oxygen level seems to be low in the pulmonary embolism. So investigation data could be hard. So it could be medium or hard, whatever you say, but not easy question. Okay? Not easy question.
Yeah, it's not.
Now only information type question. But per se, information type questions are commonly hard question. Information means like I told you, what is your name? Okay, Dr. Zareen?
Yes.
Directly.
Yes,
Information type. From the sky, you are asking something. Suppose, which one of the following true regarding acute pulmonary embolism? So actually, blindly, you cannot guess any answer. What I said in general, don't look at the option, but it will not be true here. We must look at the option and then give the answer. This is another technique, especially for, because which true, we are not sure what information is given. So immediately look at the options, 1, 2, 3, 4, 5, and you will understand that the which true message is there may not be easy. So may I request Dr. Nadrin to read one by one?
Okay.
A.
طيب, which one of the following is true regarding acute pulmonary embolism? An ECG exclude diagnosis. Embolectomy is more effective than thrombolysis in improving survival. Heparin is as effective as thrombolytic therapy. The presence of hypoxemia is an indication for thrombolysis. Thrombolysis administered through the peripheral vein is as effective as through pulmonary artery catheter.
So there are 5 type of messages. And it seems to be that I never heard about some messages here also. Isn't that it? Dr. Zarin,
Yes, sir.
have you
Yes,
heard
sir.
any message from there? At best, possibly you heard about the ECG informations of pulmonary embolism. Have you
Yes,
heard
sir.
about embolectomy comparison to the thrombolysis other?
No, sir.
So for that, in general, the information type questions, which for the following is true, almost always it is hard question. From there, you may not know the answer. Dr. Nadri, do you know the answer?
Um, maybe the presence of hypoxemia is an indication for thrombolysis.
Presence of hypoxemia is an indication for thrombolysis. Presence of hypoxemia. If you have gone through the topics, okay, you can give the answer. Let's see what is the answer. This is the correct answer here.
Thrombolysis administered through the peripheral vein.
Peripheral vein or pulmonary artery catheter, efficacy is same. Effective. This is the message. All others are wrong. Okay. In such situation, how will you give the blind answer? Actually, we discussed before. I will not talk here. Dr. Zarin.
Yes, sir.
For example, you don't know any answer from this. Even then, you must give one option for examination purpose. Which stem you will select? If you see our previous class video record also there, you can get the answer here more likely. E will be the answer in that formula. There is some technique we discussed. I will not discuss right now. So this is a hard question and information type question. Now a direct question. Following are centrally acting antihypertensive therapies. These are less common questions, and this is our traditional question like, so following a centrally acting, so which drugs are given not mentioned here? So there are many options are there. So in that case, we will not wait. We will directly look at the options. Then we will select. Centrally acting drug. Which is centrally acting drug? As antihypertensive. This type of question may be soft, may be hard also. If you don't know, I can show moxonidine, clonidine, moxonidine. These are centrally acting drugs. So there is no understanding of understanding capability needed. There only memory is important here. How can I remember? How much I remember the centrally acting drug list? There's no other way of calculation. So these are types of direct questions. So this is up to today for primary discussion of easy, medium, hard, different types of questions, and how to read the question bundle. So what the summary we can conclude today is, initially, most of the questions, we will not look at the options, right, Dr. Zareen?
Yes, sir.
But in some questions, we need to look at the option. Otherwise, I cannot give the answer. It is true.
Yes. Which is
Yes.
direct question.
Probably these are the direct question or information type questions.
Yes, sir.
So a little differently, we are telling, because the question bundles are not designed as such. They are with a question, that is the stem, then the lead in, and then options. It is visible in our eyes. So during learning, we need to cover the options somehow in the screen or in the hard copy. They cover with the paper or some other thing. I think you understand what I mean. Don't look at the option first. It will be very good brainstorming for you. And then read the description of that. Thank you very much.
Thank you so much, Doctor.
Hope to see you in another time.
Thank you, sir.
Bye-bye.